Hello. Welcome to the MalariaGEN Podcast, using genomic surveillance to better understand how to control and eliminate malaria. MalariaGEN.net. Today, I'll be speaking to Dr Shavanthi Rajatileka, a scientific project manager at the Wellcome Sanger Institute. We'll be talking about the role of amplicon sequencing in malaria surveillance and what it takes to navigate the operational challenges of establishing an amplicon pipeline in Africa. Welcome, Shavanthi. Can you tell us a little about your research background and how you came to work on an amplicon project for malaria parasites?
I came into project operations and management from a very traditional research background. I've always enjoyed working on projects with a global health focus. And this started with my undergraduate degree, where my final year project focused on schistosomiasis. This carried through my postgraduate studies, and I went on to complete my PhD at the Liverpool School of Tropical Medicine, where I investigated the insecticide resistance mechanisms in the major dengue vector Aedes aegypti in Southeast Asia and Latin America. I moved on to working in large-scale longitudinal studies. And whilst here, I became more involved in the management aspects of the studies. And this included working with developing sample collection protocols, the logistics, data handling, data protection, ethics, developing training. And eventually, I moved away from physical laboratory work. During one of my travels overseas, I got caught up in a natural disaster. Given the scale of what had happened, there was a call for anyone with any relevant experience to help, and I volunteered. And I got involved with organizing the deployment of medical supplies and other essential supplies to different regions of the country, obviously prioritizing those areas worst affected. Of course, I hope that nothing like that ever happens again, as it was a very tragic event, but it did strengthen my resolve to work in global health and in overseas operations.
Can you explain a little bit how then you made the decision to translate your work from science into the operational end of MalariaGEN?
Yes. So with both a research background in global health, along with an interest in managing these large-scale research projects, and of course, the incredible opportunity to be working with some amazing partners, I was really excited to have this opportunity to work on the NIHR project here at Sanger. I am now part of Sonia's team, and I lead the in-country implementation of our amplicon sequencing protocols in our MalariaGEN partner labs. I also think, having been on the other side of things as a lab-based scientist, I do understand the importance of the operational and management side of things going as smoothly as possible. And hopefully, this would help me support our partners effectively.
You mentioned amplicon sequencing because that's the focus of your work. Why has in-country amplicon sequencing become such a priority for MalariaGEN?
Historically, how things have worked is that the amplicon sequencing protocols have been implemented effectively in our labs at Sanger, and all our MalariaGEN partners routinely sent samples to our labs, and it went through the laboratory pipelines and the data was returned to them. But having over the years, before I joined Sanger, there had been lots of processes put in place to build the scientific foundations and to develop the underlying technology that was required for genomic surveillance in malaria. It then got to a position where we could adopt a more decentralized model and translate this into practical tools and protocols that would help national malaria control programs achieve their objectives using amplicon sequencing. From a malaria control perspective, it is essential that national malaria control programs have effective tools to monitor resistance both to know what are the best anti-malarial drugs and insecticides to use during control programs, and also as a tool to provide early warning if their interventions are causing resistance to rise to high levels and indicating the need to change their strategy. Over the years, and I'm talking about pre-COVID times, there has been major technical advances in genomic sequencing as a surveillance tool, particularly for use in antimicrobial resistance. And whilst there were many technical challenges to get this to work for malaria, we've managed to optimize protocols, and we now have the proof of concept in our Sanger labs, and it was time to start putting these systems in place in our partners' labs. And most importantly, I guess, having important genomic surveillance data is more likely to influence public health decision-making process in malaria control programs if, in fact, the data was generated in country by our partners who work very closely with their national malaria control programs.
The amplicon work that you're rolling out with partners is focusing on West Africa. Why is that the initial focus?
The work for this project is being carried out in Ghana and the Gambia, and there were several reasons why this initial focus was in this region and in those two countries in particular. One, it will allow us to optimize the surveillance tools for different malaria control use cases in a range of epidemiological settings. Many parts of West Africa have extremely high malaria transmission rates. So, for example, in Nabrongo in northern Ghana, but there are also parts that have very low transmission, for instance, in the coastal regions of the Gambia and northern Senegal. From an operational perspective, developing two labs in different parts of the same region will hopefully help us to build critical mass and regional cooperation. Also, both the University of Ghana and the MRC unit Gambia at the London School of Hygiene and Tropical Medicine already had excellent laboratory infrastructure, and most importantly, they had the equipment for carrying out sequencing, and this was a huge factor to facilitate implementing amplicon sequencing in country. Both of our partners in Ghana and the Gambia also have strong engagement with the national malaria control programs, and I think this is critical for the success of this project. And finally, I think one of the most important points was that the project has long-standing collaborations and outstanding local leadership and institutional support at both locations. Professor Gordon Avandari, Dr. Alfred Noir, and Dr. Lucas Amenga-Etago are renowned malaria experts and are amongst the most technically accomplished researchers working in the field of malaria population genetics. And they have significant experience in epidemiological, laboratory, and analytical aspects of malaria research. By the end of this project, what we hope to have is a proof of concept to build these systems into routine national malaria control operations in Ghana and the Gambia, and to hopefully provide a working model of how these systems can be deployed then at other locations in Africa and certainly at other partner locations across the world.
You mentioned the facilities in West Africa and the leadership there. What sort of knowledge and technology transfer was required to build an operational system for in-country sequencing?
I guess the first thing was to ensure that the protocols that we had were suitable to be used in an external lab. So all these protocols for amplicon sequencing, they were validated in our labs at Sanger. And we needed to make sure that our partners would be able to use these in their own labs. And certainly a lot of effort has gone into that over the years by many people. At the start, it was a bit of trial and error based. We relied a lot on feedback and questions we got from the partners, but slowly but surely we have managed to build up a set of protocols that are suitable to be deployed in external labs in LMICs. And from an operational perspective, whilst you certainly can have the building blocks for setting up an in-country system in place, you simply cannot use a one-size-fits-all approach. Every country has a different context and organizational model for setting up genomic surveillance. And it is very important that we work very closely with our partners to tailor implementation for an individual lab. I guess we also do need to consider that if you took any output data from implementing in-country sequencing, it is very important to remember that that is not just the result of laboratory work and data analysis, which of course is very important in this context, but we also have to take a few steps back and go right to the very beginning. So the starting point for this would be where the idea is conceived and put together as a grant application to get the necessary funds for the work. And if the grant is successful, like we were with the NIHR grant, then there are research collaboration agreements and due diligence surrounding good financial grant practice that need to be completed. And you need to work with different teams across all the partner sites and Sanger to finalize these before any funding transfers can take place. And from our own experience and that of others working in global health projects, these processes can take time. It is important that you assess each partner's overall setup and identify any key resources that are required, be it equipment or staff. Identify what their training requirements are, because each lab is going to have staff with a different set of experience and different levels of experience.
I'm just wondering, what were the particular challenges in setting up amplicon sequencing in West Africa?
So I think the important thing to remember is that it is not simply a case of buying equipment and training our partners. The whole process is very multidimensional, and you can encounter hurdles pretty much every step of the way. And the fun part, and I use the word fun loosely here, is that these obstacles are going to vary between individual partner sites, even if they are in the same region or perhaps even in the same country. So you never know what's waiting around the corner to surprise you. I guess the first main challenge we encountered was to make sure that we could establish a high-performing genomics lab in a partner country. And each laboratory will have different requirements for setup. And working this out very early on, I think, is very, very important to try and avoid delays. And once we had established what was actually required, then the next major obstacle was, how do we get this equipment and reagent to the laboratories? Yeah, that is not an easy procedure. There are lots of things to consider because there's regulatory and administrative procedures that are specific to a given country or a partner institution. So, for instance, we have had a case where there is one authorized distributor for Africa for a given supplier, and then you have the problem where some of the reagents, particularly the more specialist reagents required for the amplicon sequencing protocol, they could not be purchased locally. Finding the local supply chains is very, very important. The next issue that you encounter is the cost of laboratory equipment and reagents. A lot of these equipment and reagents that we need for the amplicon sequencing protocols, they are expensive in high-income countries, but it can end up being even more expensive in LMICs. And this certainly has been the case. And I think it just highlights the inequality that our partners have to face, where they're having to pay sometimes 3 to 5 times the cost of what we would pay in the UK. In addition to that initial purchase cost, and for example, with some parts of our protocols, it is important that PCR machines and sequencers would need a continuous electricity supply, and highlights that requirement where you need to spend additional resources and space on generators and uninterruptible power supplies. From a bioinformatics perspective, one of the key issues is needing a continuous and good broadband connection, for instance, for uploading the data online to run through the analysis pipeline. And through our own experience, we have seen that this can vary quite considerably depending on the strength of the connection, and it can sometimes take several hours. So our partners routinely face these obstacles as they try to implement these protocols in their labs. And a lot of this is things that we take for granted. We obviously have great research teams who are piloting the work for us, and this has made implementing this protocol certainly a lot easier for us. And of course, I do need to mention the project PIs, particularly with Gordon, Alfred, Lucas, and Olivo, who have been so generous with sharing their knowledge and experience with me. We also have an incredible resource within our MalariaGEN teams at Sanger and Oxford, where we have people such as Vicky, Kirk, Sonia, Kim, and Dominic with extensive operational experience overseas. And I have been very fortunate to be able to tap into this resource whenever I've been faced with some of the more difficult issues. And that has certainly helped assess each partner site in more detail based on their years of experience. And that has helped me put together a plan for a given partner site or country to move forward with implementing this protocol.
You've mentioned major obstacles. There's one that's top of mind at the moment, which is the COVID pandemic. What sort of impact has this had on your work?
So, like in the UK, during the first lockdown, much of the world, including Ghana and the Gambia, went into national lockdowns. And obviously, this resulted in laboratory work not being able to progress. This obviously had an impact on getting to the sample processing stage. And I think it was incredibly frustrating for our partners as they were so close to getting things up and running in the lab. From a sample collection perspective, because of the high risk involving working with patients, there were delays to sample collections, but our partners, their resilience, absolutely amazing. And it was highlighted where they worked in parallel with public health agencies, where samples were collected in parallel for both COVID and malaria work. One of the other major impacts of the COVID pandemic has been that it exacerbated an already fragile supply chain. And whilst our partners routinely would wait for reagents to arrive in their labs, they probably wait for about 3 months. That pushed it back even further. And I guess one of the more challenging aspects was, whilst the UK was still in lockdown, a lot of our partners went back into work. So we needed to make sure that we were able to continue to give them all the support that we could to help them move forward whilst dealing with the restrictions that had been imposed over here. So yeah, it has been a bit of a challenging time, but I think we have pushed forward and we are moving in the right direction.
You mentioned lockdown, and certainly international travel has changed due to the pandemic. Was it possible to move the operational end of training online?
I was quite used to working remotely because most of my job is usually done remotely as I work closely with the partners, but being based in the UK. But of course, the main difference there was I was not able to see my colleagues at Sanger as I would on a day-to-day basis. You know, when you have a quick question, you can pop into someone's office and ask them. That was no longer an option. In parallel with that, one of the other things we could not do in this instance was to visit the partner labs and carry out hands-on training as planned, and everything had to be moved very quickly to an online platform just to make sure that we could provide as much support to partners as possible. We've had several online refresher training sessions, and we continue to provide technical support to our partners either through Zoom calls or via email. But of course, nothing can replace that face-to-face hands-on training that we can deliver. But we have had to adapt, and we have learned to adapt. And hopefully we'll be able to use this as an example to build tools that are available online for our partners.
What have you found to be the main challenges to implementing in-country sequencing?
I think in the last year, the biggest challenge has been not being able to visit our wonderful partners, and not just from a training perspective, but having that interaction with them on site. It certainly helps us manage the projects and help implement the protocols in country. Whilst we can do as much as we can to support them remotely, I think there have been incredible moments of frustration where we wish that we could have just got on a plane and gone over to a lab and supported our partners on site and helped them progress towards getting towards that finishing line. And yeah, the trouble with the supply chains, as I mentioned, that has been one of the biggest problems. It is very important to celebrate those little victories as and when they come along, as they will keep you motivated to keep pushing forward.
Is there anything in particular that you've learnt in applying and building capacity in West Africa that can be taken and applied to other areas of the world?
Towards the end of 2019, which seems like a very, very long time ago, we expanded our in-country implementation operations to include 2 partners from Southeast Asia. The first is based in Vietnam and led locally by Dr. Nguyen, which is also part of the larger Mekong project, which is led by Professor Olivo Mioto. The second team is based in Indonesia and led by Dr. Rintis Novianti and Dr. Sarah Orban, and they too are in the process of implementing amplicon sequencing protocols in their labs. We are also in the very early stages of bringing on board 2 new partners from Thailand and Mali, and at the moment we are working with them to get their labs set up. And I guess following our early experiences with the NIHR project, where we had to start somewhere. So we initially worked with a top-down approach, as it was very much a learning experience for us, as it was to our partners. I think the most important change we implemented pretty much straight after that first training workshop in the Gambia was moving forward with our existing partners and any new partners was to change to work with a bottom-up approach in all aspects of implementation, particularly with the training, and that is how we would continue to work now. Every new country we work with will present a new challenge, and each partner will have a different set of requirements. And the key is to identify these issues as early as possible and put in steps to mitigate delays and potential issues. So we do have the tools for implementation. They just need to be adjusted accordingly to individual partners' requirements and needs.
What would you say are the potential benefits to malaria control of in-country amplicon sequencing?
With our current projects, we are very much in that implementation phase, but we are moving towards getting up to production where our partners would be able to start processing batch samples. But what has been great is that our partners have been and continue to work very closely with their national malaria control programs, which would mean that they're very much involved in the current process that we're going through at the moment. This would hopefully mean that once our partners start generating data, they would be in the best possible position to integrate genomic surveillance data into their routine control activities in the face of increasing drug and insecticide resistance.
Have you seen any benefits of beginning to implement these protocols and processes during the COVID period?
I wouldn't have thought we could say that there would be a positive outcome from the COVID pandemic. But I think what the COVID pandemic has done is that it has brought genomic surveillance into the spotlight. To successfully implement a genomic surveillance program into routine control programs, be it malaria or anything else, you need to have buy-in from all stakeholders. And with the COVID pandemic, the importance of genomic surveillance has been highlighted so clearly, I think, to even the most skeptical of people. And in countries where national malaria control programs have been at the forefront of the COVID-19 response, they would have been able to see firsthand how genomic surveillance has played such a crucial role globally to support major decision-making such as lockdowns and travel restrictions, and certainly infection control. I think the whole idea behind building sustainable capacity, this certainly was highlighted where our partners at the University of Ghana were one of the first teams in Africa to sequence the genome for the SARS-CoV-2 virus using capacity built for genomic surveillance of malaria. And similarly, the genomics team in the Gambia, they carried out their own capacity building exercises by training teams from neighboring countries in genomic surveillance.
What has been the particular highlight for you in this last year?
I think there have been several, if I may. I think one of the most amazing highlights of the last 12 months has been when each of our teams that have been implementing the protocol, Vietnam, the Gambia, Indonesia, and Ghana, completed their first end-to-end process in the laboratory and were able to complete their first MySeq run. Whilst there's still some further optimization to do, this is an incredible first step, and bearing in mind that the transfer of technology is challenging at the best of times, this was all done during a global pandemic and just goes to show the absolute resilience of our partners. We also have our partners in Vietnam who are now at that stage where they are ready to go. I guess another highlight was the SARS-CoV-2 virus sequence. That was done by our team in Ghana. That was an amazing achievement, and the work has been published, and it certainly put their team, very rightly so, into the spotlight. And it was one of those proud moments to see people you work so closely with doing so well. And from an operational perspective, I'm sure a lot of people are fed up of me mentioning this, but there was this one piece of equipment which was being a bit difficult to get over to West Africa. And after 9 long months, we managed to get this item to Ghana, and getting that message from the local distributor saying it is on site certainly has been one of the biggest highlights of the last 12 months. And I think I do need to add that you do need to have a good sense of humor and a lot of patience. And I think the biggest highlight for me personally has been working with our incredible partners. They are at the very heart of the work we do, and they've devoted so much of their time and resources. All the progress that they have made and their achievements, that's all very much their victories. And for me, I feel incredibly privileged to have been part of their journey.
Shavanthi, Thank you so much for taking the time to talk to me today about your work. Perhaps in another year we'll be able to meet again and hear how amplicon sequencing is progressing.
That would be great. Thank you, Heather. Bye-bye.
Bye! Brought to you by MalariaGEN.net.